Hi, I'm Dr. C. Gary Taylor, Advanced Wellness and Chiropractic. I want to talk to you a little bit today about headaches. It's a common problem that we see with patients here in the office. There can be different reasons for people having headaches. Common thing that we see is patients that have sinus headaches, especially during the allergy season. There can be problems in the frontal or in the maxillary sinus areas. We can also have all over head pain with allergy headaches. A common thing that patients don't realize a lot of times is that just by avoiding some of the problems with that by what we use is a Neomed rinse to rinse out the sinuses. It's a herbal rinse that's not a salt rinse, and it helps to keep the sinuses cleansed of the impurities that are in there that we breathe in and day out, and creates a lot of the headaches that we have with the allergy problems. So by being a preventative thing and doing the rinse, then we don't make our body have to work as hard. It prevents our body from having to form mucus, and that mucus running either through our nose or down the back of our throat a lot of times that we don't even realize that. Sometimes can cause irritation with your throat as well. So another problem with headaches is temporal headaches or TMJ headaches. Clenching the jaw can create problems with headaches, and they're usually in the face or up into the temporal region. The muscles in the side of the head get tighter, creating problems in that area. We can also have what they call a cluster headache. It's all over pain that we have inside of our head, very severe, not to the same type as a migraine headache where you're going to have some kind of aura, vision changes, you want to get into a dark room, you may have vomiting and different things that are going on with that. Or we have an occipital headache, which is coming in the back of our head, can come up into the back of our neck because the muscles are tight in the back of our head, or into the neck. All of these are different types of headaches that we see in our office. We've had tremendous success with patients over the years with headaches. I remember one particular patient that had 17 years of headaches straight, day in and day out, every day for 17 years. And he was taking about 100 Anacin or Excedrin, something to that effect, every week to try to help with his headaches. And after just a short period of time, we were able to totally eliminate his headaches, get him off all those aspirins and drugs that he was having to take. A lot of times with those things, they not only create problems for you gastrointestinally, but also taking those meds can also cause liver damage, and Tylenol is the #1 cause for liver failure. So we want to try to avoid taking those NSAIDs or over-the-counter drugs as much as we can, not to create problems. And you can also have what they call a rebound headache, which is from taking medication that creates those problems that are in our head, because the blood vessels in your head will actually swell up or constrict from different things, including heat if we're out in the sun too much, get dehydrated, which dehydration is a big problem for headaches. So we want to drink good, clean, purified water. Here we recommend Kangen water for patients to drink because the higher the alkalinity, the microclustered effect, the more that the water gets into our body and into the cells quicker, slows down the process of dehydration that we have, and creates more problems with being able to detoxify the body from the things that we have faster. So just want to encourage you that if you do have problems with headaches, there are a lot of things that can be done to help headaches, and we'd encourage you to give us a call here at Advanced Wellness. We'd love to see you. Thank you.